It's Anonymous MD with Dr. T.
And Lisa.
Dr. T brings the real and refreshing insights, straightforward, evidence-based, and up-to-date. Now here's the doctor and Lisa.
Here we go, episode 2.
Hey, Dr. T. Nice to see you.
How are you?
I'm good. Or nice to hear you, I should say.
Yeah. Big announcement today where we are. They're closing all non-essential services. So things are definitely escalating in terms of policies.
Things are about to change a lot more rapidly, I think.
Yes, absolutely. So there is some uncertainty ahead. But again, our job, me and you, is to provide some information to people so that we can mitigate the costs.
That's right. And let's remind everyone that there is always uncertainty.
Yes, absolutely.
That's right. So
that's why
that's one thing that isn't changing, everybody.
That'll never change.
The uncertainty continues.
That's part of the human experience. Actually, that reminds me, I wanted to provide a little bit more structure to our series. So today we're going to talk about flattening of the curve.
Amazing. I've had a lot of people ask questions about that who listened to the first show. So
hot
great
topic.
Stuff. Mm-hmm.
Hot topic. Dr. Fauci, he's an infectious disease specialist in the United States, and I don't think he coined the term, but he definitely mentioned it when he was presenting what the plan was in front of Congress.
Okay, excellent.
Yeah. So, throughout, feel free to interrupt and ask questions that you think.
Interrupt? Never.
Absolutely.
Never.
We need that wit, Lisa. And Lisa, right?
That's right.
Okay, let's jump into so episode 3, we're going to talk a little bit more about uncertainty and what it does to the human psyche so that we're aware of what we're about to feel and experience internally. And then episode 4 is going to be a call to action to come up with a plan that balances the human and economic costs. Because in the opinion of many economists, this may be the equivalent of the Great Depression in the late 1910s. Sorry, the late 1920s.
That's right.
Stand corrected. So any comments before we start discussing flattening of the curve?
I don't think so. I think I really want to know, what does it mean?
Yeah, that was exactly, you read my mind. Let's enter right into the definition of what flattening the curve is. So the whole point of flattening the curve is if you take a hyperbolic curve on a graph, meaning a big camel's hump, right? Mm-hmm. You can have a really tall camel's hump that's not as wide, or you can have a really a short camel's hump that's much wider. So flattening the curve is going from a big and narrow camel hump to a small and wide camel hump. And why? What's the rationale behind doing this? Do you know? Do you have any idea what it may be?
I would imagine that fewer people are going to get sick.
It's true if you added a little bit to that statement, which would, and I hope you don't mind the pop quizzes, but
I expect them.
Absolutely.
Please continue.
Absolutely. I love when you're on the spot. That's when your best shining comes out. So less people will get sick within a given time period. The same number of people may get sick in total, but at least you won't have one infusion or one peak that puts a huge strain and uses up all of the resources of a healthcare system, thereby leaving people helpless.
Interesting. I don't know that most people understand that that's what that means.
Yeah.
The same number of people are going to get sick, but that it will be over a greater amount of time so that the stress on the healthcare system will be spread out.
That's absolutely right.
Okay.
So that'll bring us into trying to understand the difference between mitigation versus suppression of a pandemic. Okay. We are seeing most governments around the world transitioning from a mitigation to a suppression method. And we saw that in the first country that was affected, China. We saw that they tried to mitigate. They failed. It was costing too much human lives and sickness. So they transitioned into a very methodical and imposed policy of suppression.
I see.
We also are seeing the same thing in Italy. And unfortunately, in Italy, the hardest hit of the pandemic thus far, because the mitigation was either done too late or not aggressively enough, they are now suffering the effects of that despite more suppressive policies.
Even more greatly than China.
Yes, at this point, China has actually, with draconian methods, been able to have only a handful of new cases per day.
So to clarify, are we mitigating or suppressing in Canada? What's our strategy right now in flattening the curve? That's mitigating?
You've seen us go from a mitigation to a more suppressive policy day by day and week by week. In Canada, it's mostly born from the fear of what may happen if we don't suppress early. And what strain is that going to put on the resources we have in our universal healthcare system?
Got it.
Do you have any questions about that?
Well, I think what's most interesting to me at the moment is what demands on the healthcare system are we most worried about? I know I've been hearing a lot about vents. Is that right?
That's correct.
Anything in terms of helping people breathe artificially is what we're talking about when we talk about vents. Is that correct?
Yes, that's correct. It's when a tube is placed down the trachea, and a machine is used to help somebody who cannot breathe on their own breathe for them. But along with the ventilator comes the need for people who know how to use the ventilator, or know how to put the tube down the throat, or know what and when is appropriate a time for somebody to be intubated. So it also puts a huge strain on the human resources we have in a healthcare system, especially with healthcare workers that have obligations at home for their children, now that we're seeing childcare centers being closed down.
That's right. That's why governments now are offering to do some childcare or offer childcare resources to healthcare workers.
That's exactly right.
Right. Because no matter what, I mean, if we get every factory out there to switch their manufacturing to creating these vents or the parts that we need for them, and we get every distillery in Toronto and everywhere else to make hand sanitizer, we still need that the human expertise and the human element there, right? So we have to keep these people well, and we have to support them.
And you're alluding to what's something that will be very important to explore in our fourth episode during our call to action, in terms of how local economies need to pivot as globalization is on suspension, to re-employ people, but to also reallocate their expertise and production to serve us the best way and the way we need them to during this pandemic phase.
Excellent. Yes, I can't wait to talk about that too.
What is the downside to suppression? Well, the downside is somehow born from the upside. Its strength is really its weakness. As a suppressive policy causes less infections in your community or environment, it can interfere with people developing antibodies and immunity to COVID-19.
Okay, so hang on, wait a minute. What you're saying is that even the good thing, which is less people getting sick, is actually also a bad thing at the same time.
Yes, in the long term, it gives the virus an opportunity to make a comeback and have a second or third or whatever number of peaks as people start to ease on their isolation. Whereas if more people got infected and lived through the illness and developed immunity to it, you'd have less people susceptible to catch the disease and pass it on to other people.
Right. Okay, well, I don't think I'd considered herd immunity in this context. Certainly, we've talked about it a lot in terms of measles and vaccinating children. So it's an interesting point.
Yes. And let's also just touch on the economic impact suppressive policies that are imposed by governments have. They essentially shut down economies. And that is the trade-off to prevent more people from suffering through the illness or dying.
So what will happen is that more social assistance will be needed to keep the vulnerable people at baseline, at a place where they are not then becoming victimized in a completely different way by this virus.
That's absolutely right. The government really sheds its true light during events like this, and taxpayer dollars become necessary in times like this to support the society's functioning. But we'll also talk about how us as residents, citizens, consumers can also help each other and help ourselves moving forward as we go through what we know will be a difficult time.
Right.
Perhaps the most difficult time in my lifetime.
I agree.
Yeah.
In mine as well, I'm pretty sure. And we do have a great deal of technology that we can use as a tool right now. And I think that's something important to remember, is that, even if we are facing something akin to the Great Depression, we do have this factor of technology that they barely had then. I mean, there was some tech, right? There were telephones, etc. So let's not discount and say they were completely middle-aged in the Middle Ages. But today we have so much. So we have to think about how can that help us with keeping commerce alive. And I think really with mental health, I'm really concerned about people being isolated who already are having mental health issues.
So, number one, I'd like our audience to take a second to recognize how brilliant you are. You bring up a couple of...
This is why I come back, folks.
That's why I need you here. You'll keep the doctor in check. So, two things you mentioned there are access to technology. We need to use that to our advantage now and spread the word. This isn't a lesson that has small implications. This is a lesson we all need to learn that has history defining implications. The second thing you alluded to was, you said that, what was the second thing you alluded to?
Was mental health. So people being further isolated that already feel sort of isolated within their own psyche.
That's very, very true, as a big risk to our society. Mm-hmm. I think we're going to touch on that in episode 3 when we talk about human uncertainty.
Okay, great. I'm really glad.
So for the sake of time, I'd like to just wrap up with the home run message from today's episode. So we've gone from mitigation to suppression policies. And because of that, it's going to have a large human impact, and also less people will be immune as we ease up on social isolation. So there's a risk that the virus peaks again and makes a comeback. So what is our job to try to prevent that or minimize a second or third or fourth peak? One, if we had a medication that reduced deaths, we would be able to build immunity through the disease process while still preventing people from dying or suffering as much. By that same token, if we are able to develop a vaccine and vaccinate people while we've suppressed the virus, then it will have a much lesser chance of having a big impact when it tries to that second, third, or fourth time.
Another way to look at that is take the herd immunity into our hands and take control of it.
100%. So I think you've basically highlighted that herd immunity can be a natural process, but humans have actually figured out how to make it an artificial process.
The wonder of humans.
The other thing we need to do is we need to test and find out who has immunity and who doesn't. Is that urgent to do right now immediately? Not necessarily. Right now we want to protect humans' health. But as we move forward, we could use blood tests that can detect old infections to really create a profile of society and understand how we can improve our protection against this virus.
Interesting. And find out how widespread it actually was in real numbers, and not just in those that we are testing and looking at those. I've also, now tell me if this is something, I've kind of also heard of a theory or a strategy in this case where what they're doing is actually once it spikes again, after we flatten the curve, it's almost like a re-flattening of the curve. So, I'm almost thinking it of like that little hedgehog game, or the moles. I think they're moles. I'm not great at arcade games, but, banging the moles on the head, that one, you smack one down and another one, and you take a break for a split second, and then you smack another one down. And so is that something that we could be looking at while we're waiting for science to sort of help us out here?
I think most specialists and epidemiologists are concluding that if we don't do anything after this social isolation campaign, that we should expect more peaks.
Mm-hmm.
And again, if that will happen, how it'll happen, where it'll happen, how much impact it'll have is part of that uncertainty that we're going to talk about next episode. So we need to think ahead and do our part to try and make these uncertain events less devastating or less negatively impactful on human beings.
Right. And let's take this as an opportunity while we are in our social isolation to learn everything we can about how to do this well and how to support our vulnerable people while we're doing it, so that next time we'll be even more effective and we'll flatten that sucker of a curve even more.
If COVID-19 has shut down your office and you no longer have work to do, our work should be to work on a cohesive and collective plan and help our government authorities fight this virus.
Absolutely. Couldn't agree more.
There is one comment I'd like to make that's related to that is there's also an economic cost that's greater to suppression opposed to mitigation. Mm-hmm. Globalization is now at a standstill. We need our local economies to band together, the leaders of those economies, of those small businesses, to pivot what they're delivering, how they're delivering it, with a focus on contributing to suppressing this virus while also providing jobs and stimulating the economy of that immediate township or region. So I encourage business owners to, instead of just shutting the door and sending all their people home, to collaborate with other business owners to figure out ways they can generate some revenue to save their business, employ people in their local community, and provide services or goods that will help in our fight against coronavirus. For example, I would be a proponent of local bakeries or restaurants or bars or breweries that are currently shut down to make a little bit of money for their own survivorship, to make something like hand sanitizer or personal protective equipment.
Right.
And
we get the hipsters in on the hand sanitizer, and then it becomes a bespoke situation. And, everyone will love it. I mean, who doesn't love homemade mayo? Really?
That is something I'm not familiar with, homemade mayo, but I can't tell you that it's
when we're allowed to go out again, I'll take you and I'll teach you about it.
I am looking forward to it.
Okay.
Do you have any final remarks?
I don't think so. I think that a lot of value is going to come from businesses helping other businesses right now. So I know I heard that my friend Michelle Romano over at Clearbank is spending a lot of time, upping their hours, because what they do is they fund e-commerce companies, right? They provide loans in a really easy way without anyone having to give up equity. They're replacing venture capital. But during this time, all e-commerce is supporting the market almost entirely on their own shoulders. So what they need is to be able to ramp up production. They need to deliver quickly, and they need to be able to employ more people. And in order to do that, they need money. So here's the team at Clearbank, trying to give as many loans as possible to make that happen. And so it's interesting that, businesses, if they can pivot and if they can grow more quickly and we can support those businesses, I think we'll be in a really good space.
Very well said, Lisa. Well, that was fun again.
It was fun.
Yeah.
Yeah.
So we'll see everybody for episode 3. Again, stay calm, stay clean, personal hygiene, and
always been a big fan of it, even more so now.
And go outside. open air is a great place to be right now.
Absolutely right. And I'm about to head out there now. I think I'm about done with the indoors for the day.
Have a great day, everybody.
Yeah. See you soon.
Thanks for listening to the show. Subscribe wherever you're listening to the podcast. On YouTube, smash that bell. That's a notification button. Anytime the doctor knows something, so will you. Stay healthy. See you next time.